deaths. So today we are going to discuss of the same question. Does gender make a difference in dealing with the pandemic, but at the local level? So we have the pleasure and the honor to have with us two speakers from Greece, Mayor Maria Androutsou and head of the opposition party, Irini Kounenaki, and then two guests, one from Norway, from the City Council of Trondheim, and the other one from the City Council of Reykjavik. So the idea is to discuss if really at the local level, during the pandemic, women made it better, or anyway, in which sense there were differences in dealing with the pandemic. So this is the issue today. We start with Mayor Maria Androutsou, who is going to give a first contribution to this question. Just some small short CV of the mayor, so that we know each other, because you are four city politicians at the city level, and it's interesting to know. So Maria Androutsou studied physics at the University of Athens and has a master's in statistics in 2005. Since 2002, she is city councillor in her municipality, and in 2010 she ran for the mayor, and she became the mayor of the city. And it is one of the very, very few women mayors in Greece. We have only 13 women mayors out of 323, I think, or something like that. Anyway, very, very small number. So Maria Androutsou is one of these very, very few mayors. And I think she's the only one that she was re-elected 2 times. Not only 2010, but in 2014, and again in 2019. So she is a successful mayor by default, let's say, proven, demonstrated. And she will tell us what she does in Agios Dimitrios, is the municipality, the city, that is for our foreign guests. This municipality is very close to the city of Athens, is in fact in the, let's say, greater Athens area, where there are 40 municipalities. One is city of Agios Dimitrios, another one is the city of Athens, and there are much more municipalities all around in the greater Athens. So thank you, Maria Androutsou, Mayor Androutsou, that you are with us, and I will give you the floor, and then we go on with our other guests.
Thank you, Maria. Thank you for this invitation to be involved with such an interesting discussion panel. I am grateful and honored to be among women from Europe who work hard to bring change to their local communities and make a difference, especially in such a difficult time. I will speak about the local governance and the pandemic. This is the type, full screen. Just a moment. It's okay. It's okay. 10 years ago, I had the honor to be elected as mayor to the municipality of Agios Dimitrios, a southern city of Attica region of more than 70,000 people. Trade, small businesses, food and beverage services are the main economic activities of the city. Activities which, as everywhere in the world, have been seriously affected by the repeated lockdowns and the government's emergency measures to deal with the pandemic. Local authorities and municipalities are the institutions of the state that are closest to the citizens. We are by their side when they need support. This, as a fact, it was also evident during the great economic and social crisis over the past 10 years. So, the pandemic crisis could not be an exception. The municipality of Agios Dimitrios reacted immediately to the economic crisis by creating social welfare programs to support vulnerable groups of the population, making full use of European programs and funds to strengthen and maintain the social cohesion in response to the needs of the local community. Since 2012, and despite the enormous municipal budget deductions resulting from the memorandums that were signed by Greek government bodies and the collapsing state social structures, we have been working hard to prevent worsening local living standards by extending outreach programs. The Municipal Solidarity Grocery Store and Pharmacy, the Food Aid Network, the community gardens, the reinforcement of the municipal kindergartens, and the psychosocial support programs for the vulnerable people were only a few initiatives that we took in response to the economic crisis. Strategically, we applied an integrated social welfare policies plan by approaching poverty and humanitarian crisis. Our experience in managing the previous crisis was very important, as the Municipal Social Solidarity Network and the welfare structures were ready to respond to the new crisis of COVID-19. In the face of the pandemic crisis, local authorities have been at the forefront of the response to contain the spread of the virus and mitigate the impact of the outbreak on their communities. We have seen the local government sector pool resources and respond to new problems with innovative solutions to expedite recovery. We endeavored to address the challenge brought about by the pandemic with a flexible and responsive strategy. From the first moment, the City of Agios Dimitrios leadership once more showed its quick reflexes and social responsibility. We will continue to do so during these ongoing uncertain times. We immediately activated the phone line known as Citizen Line with a 12-hour, 7 days a week service level in order that the municipality best serve the vulnerable groups within the population. During the pandemic, citizens without a suitable and supportive environment who were not able to allow it to move from their homes, such as the elderly, the disabled, or those suffering from chronic diseases, could call this line to access support for their immediate needs, such as food, medicinal deliveries, or other urgent matters. Additionally, since the first lockdown period, the social workers and the psychologists of the municipality have made more than 3,000 phone calls to elderly and vulnerable citizens to offer reassurance that their needs were of the highest priority, that they had enough food and a suitable support framework in these trying times. For those in need, the employees of the municipal social services offered vital services such as arrangement of medical prescriptions and medicine delivery at home, supermarket shopping and delivery, transport provision, to and from their residence to the vaccination centers, and also regular updates and advice about their vaccination and how to protect themselves from COVID-19. At the same time, we continue our support to vulnerable citizens who, as beneficiaries of the program Help at Home, Βοήθεια στο σπίτι, and the other social welfare programs, could access a substantive food aid network, municipal solidarity grocery stores for those who were under severe financial hardship. Indicatively, I should mention that 130 meals were delivered daily at home, 250 additional beneficiary households were included in the Municipal Solidarity Grocery Store scheme during the first wave of the pandemic. Home distribution of grocery products reached at 275 families in the following months of the pandemic. The municipal pharmacy was always available to the beneficiary people during the pandemic. These services and measures to protect our citizens are, of course, an ongoing commitment. Part of the economic measures that we have implemented to support the local market was the decision to suspend for a 6-month period municipal fees and municipal tax against small businesses that have suspended their operations during the lockdown. Early last year, we agreed upon a fee waiver for the food and beverage sector, whilst working closely with the Ministry of the Interior on measures to support our local businesses further. They included the exception from cleaning and electric lighting fees and the option of providing free additional public space for the table placement to maintain social distancing safety measures, whilst maximizing opportunity for those retail businesses able to operate. Furthermore, considering the pandemic, the Municipal Council decided to complete exception of municipal fees for those who met the following criteria: startup companies and social cooperative enterprises based in our city, Municipality of Agios Dimitrios. These measures and our flexible approach were implemented so that all citizens are able to regenerate as life begins to return to the new normal. I strongly believe that our thoughtful and successful response to the pandemic is related to the women working at the forefront of the municipality. In the Municipality of Agios Dimitrios, as an organization, women are at the forefront of thinking. We endeavor to implement policies that promote work-life balance for women and enhancing the municipal kindergartens, creating after-school child care programs, and providing substantive social welfare for the elderly. Furthermore, women are in the front line of all high-level positions and leadership within the municipality as employees and in decision-making position as elected. I have chosen women employees to be at the head of important departments, such as the administrative department, the environment department, and the financial department. Also, elected women are leaders of municipal institutions, such as the Cultural Organization and the Social Solidarity Organization for kindergartens and education. The President of our City Council and the Secretary General are also women. Agios Dimitrios is one of the first cities in Greece that has founded a municipal committee for gender equality. The committee is responsible for the promotion of gender equality with municipalities' administrative boundaries, as well as for the implementation of the European Charter for Gender Equality in Local Communities, which Agios Dimitrios became a signatory to in November 2011. The signature of the Charter is our public commitment for the promotion of gender equality and inclusion of gender dimension in all of our policies. Gender mainstreaming. Our next goal is to create and implement the municipality's gender equality plan, and this is now a huge challenge for us. Based on our experience all these years, I can say with confidence that all crises have strongly gender-biased impacts, and the current pandemic could not be an exception. Pre-pandemic, an increase in women teleworking would have been seen as a positive development, evidence that working time was becoming more flexible and work-life balance improving. But teleworking in a time of social distancing and lockdown is proving stressful and exhausting for many working mothers as they juggle work, homeschooling and care all in the same space and time. It has already been documented that more women than men have lost their jobs due to the asymmetric impact of the pandemic on sectors and occupations. This is not a surprise, as women tend to be overrepresented in the sectors and occupations that have been affected more by the lockdowns. But at the same time, they also constitute the majority of frontline workers. The impact of pandemic and the shock for women in the labor market has, to some extent, increased gender inequalities that already existed. The closing of schools and childcare, alongside the centrality of the home for both work and private life, has highlighted the double burden of working and caring, particularly for women. Last, but certainly not least, the pandemic has further exposed the prevalence of domestic violence, which has been a dramatic increase as confinement restrictions were imposed. The coronavirus crisis has highlighted gender inequalities and raised the danger of a possible setback of progress, especially if women continue to bear all these burdens. At the same time, the current crisis has demonstrated the potential for change and new policy development. The feminist movement in Europe, even before the pandemic, has promoted calls for the recognition of women in the economy, not only in paid work, but also in unpaid domestic care work environments. Increases of public investment in healthcare, which will lead to more employment opportunities for women. Recognition of the social value of healthcare professions and the commensurate wage in line with this recognition. The feminist approach for the economy constitutes a new strategy for the development of a care economy within a caring society that promotes the fundamental right of everyone to be able to access support throughout their life. A care economy can advance the equality between men and women in care rights and obligations and address gender inequalities and societal imbalances present in the world. We, as women in local governance, should work towards this goal together. We have this common experience. Every day, we strive for gender equality throughout our organizations and communities. We should all be together in this. I welcome your ideas and I hope this collaboration will enable us as a group to further promote women empowerment in each of our communities. Thank you.
Thank you very much. Thank you. We thank you very much. Your speech, let's say, included everything, both what you have done and also some analysis of the questions, and also some ideas about the future. And I think that the more you work with women in local government, in the local level, the more you have women, as you said. Now, after three periods of mandate, you work, you have almost all women around you, because you realized, I understand, that it's easier and more effective to have women. And I just say that during your second, I remember always during your second mandate, before I decided to run for the City Council of Athens, that I ran in 2014, but before that you had invited me to a meeting. You had a conference, a meeting on gender-based violence in the very nice, let's say, room of hall of the city of the municipal building. And I remember you were the only one that raised the issue of gender-based violence even before the pandemic brings the kind of visibility to gender-based violence, as you said. So thank you very much. We are going now to listen to Alida Johanne Domas, who is one of the youngest members of the Trondheim, of the city council of Trondheim in Norway. And you have been engaged, Alida, in the debate about gender discrimination and gender equality in local politics. And you represent the Socialist Left Party at the City Council of Trondheim. So please have the floor.
Thank you so much, and thank you for having me. Is the sound okay?
Yes, great. Yeah. And we see your presentation.
Yeah, that's great. Good. This presentation is not so much about the corona situation. I can talk a little bit more about that in the end. But I don't know how much you know about City Council in Trondheim, so I thought that I would give you some info about that, and a little bit of info about which cases we are working on now in gender, in terms of gender. And yeah, as you said, I'm a member of the Socialist Left Party in the City Council. I was elected in 2019. So, see, there. The City Council in Trondheim has 67 representatives. The leading parties in the City Council is Labour Party, the Socialist Left Party, where I'm a member. The Socialist Left Party actually has 6 representatives that are women, so that's good. And we have the Green Party and the Centre Party. The Labour Party has been the biggest party since 2003, and they have the same mayor. And so Rita Ottervik has run the town since I was 5 years old, so that's quite cool. And the statistics of mayors in Trondheim the last couple of years when it comes to gender is actually quite good, because since 1982 until today, 3 out of 5 mayors has been women. And today, 47% of the representatives in the city council are women, so that's also good. But still is the person you most likely to find in the city council is a 42-year-old white male. So we're still working a little bit on that. So I'm also gonna face some obstacles women faces on the way to achieve political achievements and political goals. One of them is harassment. And the debate culture in Trondheim in general is quite good. A few female politicians in Trondheim report threats and harassment from other politicians and residents. And we can have really hard fights in the town hall, but at the end, all of the politicians are quite friendly towards each other, so that's good. But at the same time, we know that women are more affected in a different way than men by harassment, because the harassment is more personalized, it's more sexualized, and it's focused more on appearances. So a survey done by Amnesty International a couple of years ago shows that 2 out of 3 female politicians experience online harassment. And in the general population, it is more than 1 out of 10 women that has been harassed online. I think this type of harassment is more likely to become a part right now under the coronavirus, because all the laws we have included in people's lives and all the laws and the lockdowns the local government has set has really affected a lot of people's lives. People have been losing their jobs, they have not been able to go out, and their whole life have been really changed. And I know that a lot of female politicians and politicians in general has been quite getting hard messages because of this, and getting also threats because of what's happened under the coronavirus. So that's not good. The report, the survey also shows that 78% of the female politicians who have experienced cyberbullying says that harassment has consequences for their lives. For example, many report that they had difficult concentrating and that they have gotten low self-esteem after the harassment. And this is often more shown when it's local politicians. They have more negative effects after being harassed than national politicians. So that's not good. Because this can be a democratic problem, because people maybe want to withdraw from the politics or don't want to be a part of the debate. And this is something we need to work on after the coronavirus, because I think a lot of people maybe it's not so, don't think that all politics during the coronavirus has been the best. And maybe one thing is quite easy to just send a threatening message or hate messages on Facebook or something when they think the politics is not good. Another thing that we need to work on during now and also after Corona is that women are more silent than men in the city council, because this is a problem in general. I think it's a problem in general in the working life and in all parliaments, but I didn't see this really clearly under the coronavirus when the meetings became digital, because female did withdraw from speaking. They didn't want to take the debate, and I think it was a higher threshold to maybe turn the microphone and the camera and speak into a camera instead of in front of an audience. Because although the city council is fairly equal in absolute numbers, we did see that men often speak more and longer than women in debates. And this can become a democratical problem because we don't have all the voices in the debates. And we need to work on this, both now when we have digital meetings, but also when the meetings again became physical. For a lot of young women, especially, they did withdraw when the meeting was late at night, or if a lot of men has signed up to speak, or if they didn't think it was enough time to the meeting. And all voices are equally important. So this is a problem we need to face and work on. We have a Facebook group, or like a chat group under the city council meetings, where a lot of young people are part of in the city council, and they're like sharing and for young people and young women to take the word even though it's late at night. So that's good. So a little bit about what we work on when it comes to gender equality issues in the city. Several parties, and we in the Socialist Left Party in particular, work a lot with gender equality issues. Both now during the Corona pandemic, but also when it's a normal period. So one of the cases we have worked a lot on, and we also have worked a lot on under the Corona pandemic, is the working life, because as most other countries in Europe, the labor market in Norway is quite gendered. Most women work in the public sector, in the health sectors, they are teachers, and a lot of men work in like the industries and the private sector. So as a municipality, the city is a quite big employer. Therefore, there is important that we try to straighten out gender differences when it comes to pay and when it comes to which positions people have. So we have several equal pay proportions that have been adopted in the city politics, so that's good. Right now we have the wage settlement, and we are working a lot on equal pay between the different working groups. And we also have politics that says that we need to advertise and be a provider of entire positions, because we see that a lot of positions in the healthcare sector is often a part-time positions. That's not good if women want to have economic liberation. So, but if we need to, when a part-time job is advertised, this must be justified, because we don't want these type of positions in the community. And I can also talk a little bit about what we have done during the Corona pandemic. As in general in Norway, we have had a low infection rate, we have low death rates, so that's good. But we have had a lot of shutting down the country, because we have some tops on how many that's being affected. So, and this has had a huge impact on the businesses and the schools and all the activities in the community. So we have established a business fund to support companies that have had to close during the pandemic, so that they can get the money to start up again or support. We have also, like you are done in Athens, established a Corona phone where you can call and call about Corona questions and call about other questions. And we also have made like a worry phone where if you are worried about something and if you have a problem in your life that you want to talk about, but you are not able to meet any friends or you're not able to go out, you can call this phone that the community have and talk about your problems, and there you meet some people from the city that you can talk with your problems about, and maybe this can help you a little bit through the day. And we have also had some focus on activities for children in the summer. So we have used 28 million to provide free leisure activities to children during the summer. And we also had some politics on women and violence, because we, as we have done in Athens, seen that the domestic violence and violence against women has been a little bit higher under the corona pandemic. And we also have seen that the crisis center for women that has been victims of violence hasn't got so many calls that they have done before. So that's because we know that the violence doesn't stop during a pandemic, but people are maybe more afraid to contact the crisis center and contact health centers when they are locked down in a house, maybe with a partner that's doing the domestic violence against them. So I think that's now what I had, and we can take the rest in the conversation afterwards. Thanks. You need to take on the microphone, Maria.
Okay, thank you very much, Alida. It was very nice because you didn't tell us only how was lockdown in Norway, but also that I liked very much. You showed us that even if there are a lot of women, there are 50% of women in your municipality, still there are inequalities, because sometimes we think that as soon as we have really parity democracy, that a parity participation, that means 50-50, there is no any problem anymore. But as you said, the way women and men are related to politics is different. They speak in a different way, they have different availability. So it is interesting to know that there is not, let's say, not only participation can bring the change, but also the way that we deal with politics, what is politics in our life. So this is interesting. Thank you, Alida. So we go to Dora Björn Gujondóttir. The Icelandic names is the most difficult job for this project, I think, for Progenter. But anyway, Dora, you repeat your name so that at least we listen to the correct pronunciation. So Dora is the youngest, was for 2 years, the youngest president of the city of Reykjavik, of the city council of Reykjavik. And she has studied in Oslo, in Berlin, and then she went back to Iceland, and you have been working with Pirate Party. Tell us a little bit about this Pirate Party. I don't know how it's pronounced. And now you are a city councillor of the city of Reykjavik. So please have the floor, Dora.
Thank you so much, Maria. Thank you so much for organizing this event. It has been really interesting so far, and I really look forward to the conversation afterwards. Yes, I come from the Pirate Party. That is correct. I was the youngest president of the city council that has been here in Reykjavik the first year. I will say my name. It's difficult, I believe. Dóra Björt Guðjónsdóttir. But I really respect your attempt at it. I know that it's I know that it's difficult. So I come from a party that is based on working for more democracy in our society. It is connected to different realms of this: transparency, anti-corruption, the rule of law to be proper in our society, and basically for everyone to have the same opportunities. That is our aim in this party. We also it's based originally in Sweden. It was founded there originally, so we are an international movement. It's also for the freedom of the internet and so on, which is very connected to our democracy and transparency aims, and our aim for the freedom of information, which is really an important foundation of democracy. And equality, of course, is very related to this, because you can't really have democracy without equality, because democracy is the rule of the people being having the possibilities to affect the governance of the community, and equality is a foundation of that work. And I am now, and I was before as well, chairperson of the Equality Committee of Reykjavik, which is called the Human Rights, Innovations and Democracy Committee. But my co-worker from the same party, that is also a city councillor in Reykjavik, is now the president of the city council, and that is the first trans woman to ever have that role in Reykjavik. That is my Pirate Party co-worker in the city council. The city council now has Reykjavik has more women than ever. We have 65% of the city council as women. It's 15 women and 8 men that were elected in the year 2018. In my party, the Pirate Party, we had 5 women as the top 5 candidates, and that's without having any quotas for that. It was just the aim of my party it was just how it was. But we have many parties in Iceland that want to have lists that have different genders, and that is really well mixed, and many have quotas to work on that aim. But my party doesn't have such quotas, so we have 5 candidates that are only women, and one of them is a trans woman. But we have now we have 8 departments in Reykjavik, big departments. We have the city council, and then we have 8 departments that are the big departments that run the city. We have an executive committee on the top of that as well. We have different committees that work on different goals and different aims, and then we have the executive committee on the top and the city council on top of that. And I'm also a member of the executive committee. The Pirate Party is a part of the majority of the city council now. We are 4 parties in the majority, and we have had that collaboration since the year 2018. 3 of those parties had the collaboration 4 years before that. And we have 8 departments, and of that department, since we're discussing gender in these 8 departments, we have, of course, 8 leaders of the different departments, and 5 of those leaders are women. So we have a lot of women in Reykjavik having the power, but still we have the mayor of Reykjavik. He is a man, Dagur B. Eggertsson. He comes from the Social Democrats, and he is my colleague in the majority. So we have had, you all have said so many good things about what what you have been working on in the pandemic. We of course have had a lot of focus on this here as well. We we decided here in Reykjavik to use our force and our possibility to help the society in a time of difficult economic situation, and we decided to make a plan, a strategy surrounding what had to be done during the pandemic. We call it the Green Plan, and we decided to set sustainability as a guiding concern for our council's financial and infrastructural plan in the wake of the COVID-19 pandemic. It's our restoration plan, basically. That is something we're going to follow for 10 years. And it's both, it's many different angles that is concerning this. We have 3 dimensions. That's the financial one, a social one, and an environmental one. So we have this restoration with this vision, basically. And we wanted with this plan to try to emerge in a sense stronger from the economic crisis with robust investment in green transport, green neighborhoods, green innovation, and green jobs. And we have this as a plan that is related to all sections of our work. It is related to the schools and the leisure departments, the homes, the businesses, and also the infrastructure. So we are building a lot, and we are trying to learn something from the history, because we saw after the 2008 crisis that when the public sector doesn't invest, and the public sector also has to keep back from investing, that has a really bad effect on society for the years to come. So now we had more space and better economy to invest, and that's what we decided to do. Although it of course means that we don't come out with a plus in the end of the year, we come out with a huge minus, but we decided to do that because that's better for the society, that the public sector takes its responsibility if it can. And a part of all of this work that we are doing, a work that it really is concerned with making jobs for people in different sectors, and also green infrastructure, is we wanted to launch a city watch in welfare and work-related issues, because we wanted our work, we of course launched work, but we also wanted our work to be based on information. So we launched this city watch to better monitor what's happening in the city from month to month. And we are getting quarterly reports to the executive committee on what's happening in welfare and job-related issues, so we can adjust our measures based on these numbers and statistics. And that's a really big part of what we are doing. And and that's something, if I just come quickly to what we are discussing here today, this kind of statistically related method, being sensitive to the changes and what's happening, I think that's perhaps something that's related to gender in some ways, not thinking, this, I think it's a democratic approach, but it's also maybe a gender related approach, a softer approach that maybe women have learned more to work with through the ages. It's being sensitive to the surroundings and the needs of the surroundings, not thinking that we know best, but asking what you need and how can we help, and giving the help on the basis of the groups that we are giving the service to. We have, of course, adjusted a lot of our services. We have been able to keep our welfare services that are very a big part of our economy, of course, our welfare and school services up through the pandemic. We have been luckier than many, so we have been able to keep our school system running through most of the pandemic. Now here in Reykjavik, we don't have any measures, COVID measures, because such a big part of the nation today has had the pandemic, the shots. So it's actually no restrictions here in Reykjavik today. So that's something that just happened a few days ago, and I think we are the first country in the world to drop all measures. If I'm not mistaken, I might be, but we are at least one of the first. But one thing that we have focused on a lot is keeping our services to minorities good through the pandemic. We have been very ambitious when it comes to our welfare services. We are always very ambitious when it comes to this, but we have been thinking about how can we take care of the elderly through this crisis. We have been using new welfare technologies to reach them, to prevent isolation. We have been using a lot of new methods and innovation in our services to be able to meet people where they are and to be able to get around the pandemic. We have also been ambitious when it comes to homeless people in the pandemic, because of course you can't really keep 2 meter distance, or you can't really isolate or keep yourself away from people if you don't really have a home. So we have rented houses for people who don't already have houses, so they can live there and also have more space than before, because we have a lot of homes where we are trying to meet homeless people and people that don't have a stable home on their terms. We have this Housing First project that we are building on this method, which is very concerned with meeting people where they are on their terms, and we rented more houses so that our shelters are more spacious than before, so that people can be there and have enough space and privacy and be safe. So we have our focus has really been on making everyone safe through the pandemic. So, but we see, as in other countries, in our statistics, increased domestic violence that has been really going up, as in most other countries. We also see more women dying due to this domestic violence. We see violence in of course, restaurants and bars and in the nightlife going down, but that's of course because that has mostly been down. And but we see a lot of effect on gender. It has been discussed previous here today that everyone being at home, it has affected women a lot, of course, because women here in Iceland at least work a lot, and they're a really big part of the job market, but then they come home and they have their second or their third shift, and that's and even more so now it has been more so now during the pandemic than before, and it's a lot of pressure on women. We can see this maybe being related to the statistics, because we see people that are no, I'm searching for the English word, that die during their own because of their own decision. Suicide, sorry, thank you. That's going up, and it has been going hugely up due to with women. So we have seen that over doubling between the years and tripling between a few years from before that. So that's really interesting to see that that suicide is going up for women, and especially women, older women over 60. So interesting to explore if this is related to the pandemic and more pressure on women in the workplace, no, in the home, or some sort of situation when it comes to this. So I think gender is a huge issue when it comes to the pandemic. Both all statistics is very gendered, but we also see that where women are in power, I think the welfare issues are really being looked into and focused on a lot. I also think the sensitivity towards the needs of different groups is something that is focused on a lot. We have been focusing a lot on here in Iceland that we can see that the work market is making a lot of new jobs, but it's more jobs for men. But we also see that men lost their jobs more in the pandemic. But I think it's then something that the public sector has to focus on to make also jobs for women. We also see that people with immigrants and people with different backgrounds that come from other countries, they have lost their jobs more than Icelanders or people with Icelandic origins. And that's something I think the public sector really has to focus on. That's something we have been focusing on in our measures. So I do think gender has something to do with how we are meeting the pandemic. We can also see it in other cities around Iceland or in towns where there's a lot of men, and it's they're really I feel, I can only say I feel, I have seen some statistics, but I didn't find it when I googled it shortly, but I feel that we are focusing more where there's a lot of women on keeping everything afloat, making sure the welfare is good, instead of just making sure that our numbers are good. But in other towns we hear that they're really proud that their numbers are still good, but what I do is I ask, who is really paying for this in the end? If your numbers in your bookings for the city or the town is good, like, who is really paying for this now? I don't think that's something you should really be proud of in this situation, in the pandemic. I'm not gonna continue. I think we're gonna have a good discussion, but thank you so much.
Very much. Thank you very much. Thank you very much, Dora. I think that we share, although we are really at the other side of the Europe, Iceland and Greece, but we share the very big economic crisis that we had before the pandemic, as you said. And it reminds me all this debate about investing more in the public sector and so on. So you learned, I understand, a little bit from the huge economic crisis you went through. And I think that it made it a little bit easier for during the pandemic. And thank you for really covering all the issues of gender impact in everyday life. And this is very, very important. And congratulations for being just women in your synthesis of the municipality. I mean, huge percentages. In Greece, we are very, 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 very low. I told you about, especially the local administration, local government, we are even less than at central national level. Anyway, so it was very interesting anyway. Thank you for being here. Our last speaker is again from Greece, from another municipality in the greater Athens area, Attica, we call it Attica, the region. Anyway, so it is Irini Kounenaki, who is a sociologist. She was a deputy mayor for social policy in the previous term mandate. She ran for mayor, and now she is head of the opposition party, and at the municipality of Pallini. Pallini is another municipality in the center of Athens. She has studied sociology in London, in the London School of Economics, master degree. And so, Irini, the floor is yours.
I would like to thank you, Maria, for inviting me to participate in this very interesting cross-cultural panel. I'm really honored to participate. And I would like to clarify that I am elected at the municipality of Pallini, but I work for the municipality of Niki Arendis. So some of the things that I will mention cover both municipalities. Since the beginning of the coronavirus pandemic, we have witnessed many of the effects this crisis had on our societies, including the devastating impact on women and gender inequality in general. This pandemic has highlighted all kinds and all types of inequality, and as was expected, gender equality was hit once more. As has been reported, on the one hand, we are seeing an increase in gender-based violence, pressure on women from unpaid care and housework. At the same time, the ongoing destruction of the public health care means that health services are overburdened and women's reproductive and sexual health services, as well as prenatal and postnatal care, are disrupted. On the other hand, we see the bravery of those working in the healthcare sector who continue to care for the sick, the elderly, and all those in need. This crisis has seen local governments and mayors take the lead in acting and serving their citizens. As in the case of economic crisis, governments stood up to protect their people once more, as Maria Andreou described very well earlier on. This brings in for discussion the issue of governance and the gender of political power, especially in Europe. Women are underrepresented. As you all know, only 20% of the 1 million local and regional elected politicians in Europe are women, and only 29% of councillors in Europe are women. In Greece, women are persistently underrepresented in local governments, and since the last local elections, that was in 2019, only one of the 13 regional governments and 18th of the 332 mayors are women. What are the issues that this pandemic crisis brought in? I think that now, more than ever, local governance decision-making must be inclusive of the voices of women and youngers. We need to collect gender-specific data on the disease health, the infrastructure deficits, the financial impact of the policies that were supported, the burden on care, sexual violence, and sexual abuse. The gender perspective is crucial on the ongoing discussion about the recovery strategy at all levels of government. It seems that women carry a different type of burden from COVID-19. Inequalities that exist already, which disproportionately affect well-being and their capacity to cope financially during the isolation. At the same time, there are strong concerns about increase in domestic violence. For women, staying home did not mean staying safe. Despite the fact that up to now there is not comparable European Union data available, national reports show that domestic abuse has increased over to 30% in some cases following the traffic restrictions. How well are the local governments in Greece equipped to anticipate all this? As a case study, I would like to mention what has been reported for the municipality of Nikia Agios Ioannis Rendis, an area of the region of Piraeus. According to the Violence Women Counseling and Support Center, Since 2013, up to just the period before the coronavirus pandemic started, the incidents were frequent but stable. Since the beginning of the pandemic, this pattern changed dramatically. Initially, in the first period, due to the restrictive measures, no incidents were reported. Not because they didn't exist, but because of fear, because of traffic restrictions and the different way of the social services operation. At the end of the year, and when it became how the social services work, many new incidents of violence came to the face, as well as the old ones that came up with more intensity and frequency. Old incidents that were under surveillance, prosecutional orders in the social services department during the pandemic had frequencies on the issues such as the custody of children after divorce, where due to the work suspension, the father wanted to take the children often, the mother did not give them, the conflict became violent, the calls to the police for the same incident were at least twice a week, and prosecutional orders multiplied. Violence against women seems to be in the age range 35 and 60, and of course in the age of 60 and over the case clearly less, but they are difficult as there is a different mentality of treatment. How did we react? How did the municipality of Niki Arendi react? Due to the lack of state infrastructures, the social services department, as Maria Androutsou mentioned earlier, had developed the initiative and cared for all those women that needed help. And of course, the closest violence women counseling and support center, which is at Chiarazzini, helped a lot in facing all this problem. We at the municipality of Nia have signed the Charter of Equality, and here allow me to remind the people that are present that Maria Stratigaki, as Secretary of Equality, was the person that insisted on 2012 to develop the UN Charter of Equality in Greece and call up all men to sign it. We have as well the Committee of Equality. However, we were faced with the state deficits on the infrastructures. So one of the most actions that we need to take right now is to establish adequate structures and facilities for those women who need aid from domestic violence. It is a basic challenge for local governments to ensure women's organizations and shelters have adequate resources. Fortunately, there were quite a lot of municipalities, not only in Greece, but in Europe as well, that took the necessary steps in order to anticipate these social problems that came up from the pandemic crisis. However, I would like to state in my closing remarks that the COVID pandemic is an opportunity to turn it into an opportunity to change things. Change things that are related not only to public health and social infrastructure, which is affecting mostly women, but also to change issues and perceptions related to local governments and women's participation. We may see it as an opportunity to become more aware of our public social infrastructures. We need a constant and ongoing assessment of what are the target groups that we need to orient our policies. This presupposes a new social policy model that will ensure participation at all levels and that will establish a bottom-up designation of these policies. A common goal of all governments, civil society organizations, pressure groups should be to ensure that we do not go back to normality without ensuring that recent pandemic experience will be taken into account. Some issues such as gender-based violence escalated during the restrictive measure, the difficulties faced by women across the European Union and in our countries and in Greece as well, in combining teleworking with other responsibility. Local and regional authorities all over Europe are calling for structured participation in both the European Network for the Prevention of Gender-Based Violence and the implementation of the European Union Awareness and Communication Campaign. They also call for adequate funding for gender equalities in the next period, 22 to 27. At this point of discussion, I think it's crucial to raise the issue of equality and in the distribution of the recovery fund. The gender perspective should be applied to all funds spent under available recovery tools, and should adopt new tools that integrate the gender dimension, not in the general way, as has happened up to date, but in a very concrete and effective way. Finally, I would like to make a final comment that the COVID pandemic is, of course, a major crisis and has serious implications for the health and lives of millions of people. But it is all challenge for change, including a wake-up call for gender equality, especially in local governments. Thank you.
Thank you, Irini. Thank you, Irini. It was very nice to hear all this, and especially the last about the recovery fund. I think is very, very crucial for Greece, much more than in other countries. And you know very well how much I share this, this, let's say, gender budgeting of the recovery fund. I know that Mayor Androutsu has to leave, and I wonder, do you want to say anything now? There is one person who wants to talk, Danai Vlahu, but if Maria, you are very in a hurry, you can say something and go, and then we go on for 10 more minutes discussing with the rest of us. Tell us, what do you think?
Thank you very much, all of you. Really, I have to leave earlier because there's a meeting, very important meeting that I couldn't postpone. It's very useful, this discussion. Thank you, Maria.
Okay.
Thank you, all of the ladies. And,
Okay.
Chair.
Thank you for being here. We will be in touch for further collaboration, I think, with the Nordic countries. Okay. Thank you, Maria, for being here. I give the floor now to Danai Vlahu, who wants the floor. And then, anyway, we are going to finish in 10 minutes, but just to have an input by somebody from the audience. Yes, Danai.
Good afternoon to you all. Thank you again for organizing another very interesting discussion. And well, I wasn't from the beginning on, sadly. I missed Miss Maria
Androutsu.
Unfortunately, but I had the opportunity to listen to the rest of the speakers. I wanted to address a question towards Miss Irini, who sadly I don't see the whole name. Kounenaki, thank you. And this is regarding her work in both the municipality of Pallini and the municipality of Piraeus, part of Piraeus, which
Nikia.
Which what is quite interesting to mention, I think, is that those two municipalities are of a different social, financial realities compared to each other. So to me, it would be interesting to know whether there were, since you had experience in both of those municipalities during the pandemic and before, and possibly, after, we don't know yet. Are there any differences in how the gender issues are being treated?
Thank you very much, Danai. This is an intersectional question between gender and class, so we touch the term intersectional on this question. I don't know if there is any other question. Anybody else who wants to talk, to say something, because this is the last chance to have the floor before I give the floor to Irini to respond. Okay, I would like to make maybe a question for all the three remaining here. Then you have the chance to reply, and then we close the session. I would like to ask everybody, the three speakers we have with us now. I mean, if the pandemic was something that it was, let's say, new for everybody. We couldn't expect that we would have such a big crisis. My question is, if now that we have the experience of the pandemic, if there is one more, let's say, a new situation like that, I wonder what would be the urgent action, that the urgent things that we know now that we should do before such a big crisis, and if it is different, if there is any difference from what it happened now. That means, is there any lesson learned for the future similar crisis? Because it was really new for everybody. So this is a general question, but I think it's interesting to know if finally it was something that we learned for the future as a society, as a group, as women, as local governance, and so on. So this is my question for all of you. So let's now have a small round. I don't know if maybe Irini start and reply to both questions, the question by Danai and my question, and then Dora and Alida.
Okay, let me answer to the nice question first. I would like to say that in relation to the effects of the pandemic, I think the picture was the same at all societies. What was the factor that differentiated them is the readiness to react from one municipality to the other. Maria Androutsou, who has developed the social services department since the beginning of the financial crisis, was more or less ready to react to all these coming effects. In some municipalities, due to the lack of personnel, specialized personnel, also let me take this to mention that in the majorities of the municipalities in Greece, there is a lack of social scientists, social workers, psychologists, sociologists, all people that should be at the front during this pandemic crisis and also during this economic crisis. So this lab personnel differentiates the final picture of how the municipalities were to face the effects and the pandemic, the effects of the pandemic.